Can high PTH cause osteoporosis? Imagine your bones as a busy construction site that's constantly being rebuilt and repaired. Hormones act like foremen, directing this process. One of these hormones is called parathyroid hormone, or PTH. It's produced by tiny glands in your neck called the parathyroid glands. PTH's main job is to keep your blood calcium levels steady, which is vital for many body functions. When blood calcium drops too low, PTH kicks in. It signals your bones to release calcium into the bloodstream. It also tells your kidneys to retain calcium and helps activate vitamin D, which helps your gut absorb calcium from food. This process is normally balanced, but problems happen when the parathyroid glands become overactive. This condition is called hyperparathyroidism. In hyperparathyroidism, the glands produce too much PTH. This excess hormone causes your bones to release more calcium than they should. Over time, this increased breakdown of bone tissue leads to a decrease in bone density. Think of it like a building losing bricks faster than it can be rebuilt. This weakening of bones makes them more fragile and prone to fractures, which is the main feature of osteoporosis. Medical studies show that chronic high PTH levels are linked to increased bone resorption, meaning more bone is broken down than formed. This imbalance results in thinning bones, especially in areas like the spine, hips, and wrists. If hyperparathyroidism remains untreated for years, the bone loss can become severe enough to cause osteoporosis. Interestingly, PTH isn't always bad. When used in controlled, intermittent doses, synthetic PTH is actually a treatment for osteoporosis because it stimulates new bone growth. But this is very different from the continuous high PTH levels seen in hyperparathyroidism, which cause bone loss. Diagnosing hyperparathyroidism involves blood tests to measure calcium and PTH levels. If someone has osteoporosis along with high calcium or PTH, treating the overactive glands is crucial. Surgery to remove the abnormal parathyroid gland is often the most effective way to stop further bone loss. Sometimes, bone density can improve after treatment. Understanding how hormones like PTH influence bone health helps us see that osteoporosis isn't just about aging or diet. Hormonal imbalances can be a significant cause and are often treatable. If you have osteoporosis, especially if it's early or severe, it's important to get checked for underlying causes like hyperparathyroidism. Always consult with a healthcare professional for personalized advice because each person's situation is unique. In summary, high PTH caused by hyperparathyroidism can indeed lead to osteoporosis. It increases bone breakdown, reduces bone strength, and raises fracture risk. Early diagnosis and addressing the hormonal imbalance are key steps in protecting your bones. Remember, managing bone health involves understanding all the factors at play, including hormones, and working with your healthcare team to find the best approach for you.